Mike, thank you. News5 Investigates has uncovered millions of your taxpayer dollars are being used to staff the mental health hospital in Pueblo with temporary employees. A state budget report shows the hospital overspent $13 million to try and keep the hospital staff. $13 million is a small piece of the state's nearly $40 billion budget. The mental health hospital is currently offering a $14,000 sign-on bonus for new nurses. The Department of Human Services says it's hired 69 employees since the bonus went into effect. About half of those are nurses, but in the meantime, 48 employees left, including 26 nurses. I wanted to know, how does the state hospital plan to stop relying on contract workers and save you tax dollars? The mental health hospital in Pueblo employs hundreds of people in the city. The jobs are typically high-paying compared to the median income in Pueblo. Many patients here have been charged with a crime and are receiving treatment ordered by a judge. But the hospital is facing its own kind of trouble. How would you describe the staffing situation at the mental health hospital right now?
So I would say that currently we are utilizing quite a few contract staff.
Jill Marshall is the hospital's CEO. Recently, a request was approved by lawmakers at the end of the fiscal year in June, after the hospital went $13 million over budget to cover the cost of temporary employees to staff the hospital.
It is something that we've had to rely on with the national staffing, nurse staffing shortage. We have had to utilize quite a few contract staff.
If lawmakers did not approve the request, the department would be put in a difficult spot, because then they would be forced to cut the budget for the upcoming year by that $13 million. In the hospital's request to the state's Joint Budget Committee, it showed 232 contract nursing staff were working at the hospital compared to 322 state staff. In July of 2021, there were 55 contract workers. The hospital is considered fully staffed at 675 nursing staff. That same report shows an increased cost for temp workers, $120 an hour compared to $50 an hour for state employees. That's including benefits. Why is it that your temp workers are paid so much more?
So the temp workers are paid by their agency. We pay a rate to the agency. So I'm not exactly sure how much the workers are being paid from their agency, but I know what we pay the agency for the temp workers.
And how much is that?
So it just depends on the agency. I'd have to look and get you those numbers.
The JBC report is what I'm going on. It says that it's about $120 an hour versus $50 an hour, including benefits for your state employees.
For state employees, the contracting is actually done in an office that's outside of the hospital. It's done in our finance division, so I'd have to get those numbers from them on the contract.
After this interview, we did receive numbers the hospital has paid out to temp agencies, but it did not show us the hourly rates negotiated. Instead, it showed the total amount paid, which included more than $57 million for the 2023 fiscal year. I asked for the hourly rates, but did not get them in time for this story. But here's what Marshall did tell us.
We've had several of our contract employees are employees that were former employees of ours. So they still continue to want to work here. They just work for a contract agency.
And are they making more?
I would assume that they're making more. Like I said, I don't know exactly what they're being paid.
And is the hospital taking them on simply because you need the staff? Because I know there's a lot of companies who would say, well, you left us once. Why would we take you back now?
Yeah, sometimes it boils down to expertise because we serve such a specialized population. So if we're able to hire on someone that has a different expertise, or we have enough people with that expertise, then we would certainly utilize those services instead.
On one hand, it is a luxury. Not all state agencies have the ability to bring in temps to backfill staffing holes. But on the other hand, it's super expensive.
Hillary Glasgow is the executive director of Colorado Winds, the union representing state employees, including those at the state mental health hospital.
The state is not a place where you can be a gig worker. Like you can't, it's not you show up and you can do this work you can pick it up really quickly and you're doing it and then you can leave and go somewhere else.
Last month, hundreds of state employees at the hospital were put through a schedule rebid where they had to ask to stay on or move their schedules. It's something Glasgow says upset many workers.
My concern, and all of our concern, is we know we're understaffed and we know that they're doing things to try to bring staff in, but keeping workers in constant turmoil does not make people stay.
We also heard from employees who did not want to go on camera who echoed that sentiment. Workers felt blindsided by the rebid process. Emails requested by News5 Investigates demonstrate the frustration by workers at the hospital. One worker sent an email to hospital leadership saying, quote, "We as staff are exhausted at this point of the transparency the hospital talks about." It goes on to say information that has the possibility of disrupting a major part of our lives should be something that is discussed with us as soon as it comes to the table. In another email, a lead nurse said, quote, "I know this is going to benefit some and cause turmoil in others." Another healthcare tech wrote to hospital leadership saying the rebid process put, quote, "unnecessary stress and anxiety on the staff and the patients."
Recruitment is really important. Retention is equally important, if not more so.
Marshall says 10 employees left last month since that rebid happened, and 6 of those were nurses. Do you think that played a role in those people leaving?
It played a role in some of it. A lot of the feedback that we received were it was not the nurses who actually left, but we had some of the nursing staff that left, and they left for other opportunities for themselves. And specifically to continue their schedules or their salaries or just different opportunities. A lot of them reported personal reasons.
The staffing shortage is having other impacts on the hospital. Currently, there's a backlog of 456 patients to receive competency restoration treatment. Without going to the hospital or another facility in the state, the patients remain in county jails. The federal government fines the hospital $500 a day per patient with this backlog. Those fees are capped at $11 million, but this report says without that cap, the Department of Human Services would owe more than $62 million. Is it fair to say that the hospital is essentially right now just budgeting for that fine cap of $11 million?
So the fine goes to the department, and the budgeting for the nursing staff comes to the hospital. So we're budgeting in order to get enough staff in so we can make sure that we can open up beds and have more bed capacity for those who are on the wait list. And so that will help certainly get more people into the hospital and get them the treatment that they need.
The state budget bills from this current fiscal year and last year show lawmakers budgeted $12 million for those fines in the department's budget. When do you think, realistically, you could have a fully staffed hospital, or at least a hospital that isn't relying on hundreds of contract workers?
Well, I'm hoping that over this next year, we'll be able to work through it.
I did hear back on those hourly rates later today. Here's what I learned. The department said the average rate that the hospital paid out to agencies for this new fiscal year, which started this month, is $109 an hour. But it really depends on the position the agency is hiring to determine just how much those workers are being paid hourly. We did find some job postings showing agency jobs paying between $55 to $65 an hour, with up to $97 an hour in overtime for nurses. During a final fact check on this story, I asked the CEO why she would not know the answers to this supplemental budget request. She said her role as CEO is not traditional. She does not supervise the finance department. The Department of Human Services, which the hospital is under, has its own CFO. But we felt it was important to press her for answers on staffing and the need to rely on so many contract workers. We do want to give you some perspective on the nursing shortage. The Bureau of Labor Statistics estimates that there will be a need for 3.3 million nurses by 2031, and that each year there will be about 200,000 job openings. In Colorado, a recent report by Mercer, that's an HR consulting firm, shows the state is predicted to be one of the hardest hit in the country, with a shortage of about 10,000 nurses in 2026. Since the bonus went into effect in March, Marshall told us the hospital hired 17 nurses. That's about 4 a month here. Now, in order for the hospital to be fully staffed without contract workers by this time next year, the hospital would need to hire between 20 to 30 nurses a month. Lawmakers in the budget hearing say they're looking at other options when it comes to making the state hospital an appealing place to work. We'll follow up with them to see what happens.